welcome back, everyone. I hope you had a good lunch. The food was yummy, no doubt. Especially that cake. Oh my god, that was yummy. Let's move forward. Are we ready? Okay. Now let's move on to our speaker session, which will be on the topic of plant-based alternative and its growing impact on the mindful consumption. The consumption of a plant-based alternative is believed to be better for individual health and the environment. In such scenario, the question arises, is it really paving the way for the mindful consumption in terms of nutritional intake and sustainability? To get answers, please put your hands together to welcome on stage Rohit M. Carlo, Chief Marketing Officer of Aldeco.
Hello. Hi, good afternoon, everyone. My name is Rohit. Nice to have you guys here. I'm going to make this a short, interesting, and beautiful presentation. I work with this brand. We actually co-founded this brand called Altco, which is the plant-based alternative, and we're the first plant-based homegrown brand in India, focusing on everything plant-based in terms of food and beverage. Currently, we've got a couple of products in the market with our oat milk and almond milk. And in the coming months, we're going to be launching an entire portfolio of F&B products that are focused around the whole plant-based alternatives, catering to that segment of the audience that cannot, consume regular dairy products because of their allergies or the fact that it has gluten and lactose. These products are all lactose-free, by the way. And it's been 6 months since we decided to get into this segment. We actually started with importing a big oat milk brand into India who weren't able to cater to our requirements, and decided that we'd start our own brand, homegrown brand at the same quality and maintain the same quality and produce it in India, supplying right now to 3 countries, and hopefully we launch in the UAE as well in the coming months. So we've prepared a small PPT for you guys to understand what we do. So this is who we are and what we're trying to cater to. We want to position ourselves as one of the brands that's catering to this segment and only this segment, and not diversifying into multiple various other verticals. And what we've learned from this segment over the last 6 months has been that there are a lot of people, not only who are plant-based and who are into plant-based products and vegan, but there are a lot of people out there that are just consuming these products now because of COVID hitting and everyone becoming health conscious, moving towards sustainable choices. So we decided, why not give them something that they could pay top dollar for, but also maintain great quality and great taste. So basically, the entire segment right now in India is very fresh, is very new, is growing on a month-on-month basis, and we're taking feedback from consumers as to how this segment is going to be the future of F&B. Is what most of the big B2B players are also supporting us in a lot of ways, and helping us grow our products and improve our quality. And we want to see how we could take over the market, and also at the same time be present in every household, which is something that's tough right now. But over the coming years, we'd be very hopeful to see that this segment will actually grow and turn into what it's actually, the potential of it, and see how we can cater to the market share and also compete with other brands in the market. So these are a few things that every plant-based company right now is focusing on, these aspects. Making sure we're gluten-free, no artificial flavors, keeping it organic as much as we can, and also making sure that it's affordable, because a lot of people usually tend to go towards the vegan aisle in a supermarket or towards the plant-based aisles, purely because of the mindset that some people have against this segment. Is something that we're trying to change avidly. And we're doing a lot of consumer sampling, a lot of trainings with baristas across brands like Starbucks, Third Wave, Blue Turquoise, which are all back in India, and seeing how we can get more and more consumers to try it out. Because what we've realized over the last 6-8 months is that once the consumers try these products, they actually like it over regular milk. And once they know that it's available at an affordable price point, they don't really mind making that switch. So it's not really a hard sell, but it's also, focusing on getting them to try it the first time, which is what we're trying to target right now. And those are the kind of activities that we're focusing around in terms of marketing, social, digital. Most of our campaigns that we're running right now are purely based on educating these consumers on how these products are better for you, while also showing them that it's available at a very affordable price point and maintaining the best quality that there is. So few of our key objectives when we started out this business was to make sure that we're trying to be completely sustainable, making sure our packaging is sustainable. We decided not to go with plastic bottles, glass bottles, because it's very hard to recycle them in India with the infrastructure that we have. So we decided to stick to Tetra Paks for now. We're launching multiple SKUs, smaller SKUs for households. We've also introduced a cold storage logistics facility that caters to people and consumers, and keeping in mind the fact that it's easily available to people across India, which is a very huge country, and logistics is a pain for businesses right now. Partnering up with the multiple logistics brands and making sure we're available at least in the top 8 metros of the country, and soon in tier 2, tier 3 cities as well, is our goal in the next 3 to 6 months. And also launching in markets like Singapore and Sri Lanka is a couple of countries that we're present in, and hopefully, like I said, in the next 2 months we want to launch in UAE as well, with some of the largest distributors that we're in touch with over here. So this was a brief slide that I prepared on the market size of this segment. Not a lot of people actually value the market size of this segment because they think the vegan market or the plant-based market is very small, and there are a lot less consumers in that segment. But again, what we found out with the consumptions that we had and the orders that we were getting and the size of those tickets that we were getting was that there are actually a lot of people that are lactose intolerant and don't even know about it. And they still consume cheese, milk, and face those issues, and they don't even know about it, which is quite funny. And that's a challenge that we're facing, and that's something that we're targeting to, through our marketing and our communication, trying to achieve and see how we can convert those clients into consuming these products. And the global market size right now is valued at 29.4 billion, but again, with brands like Oatly and a bunch of others in the market, is only going to grow, and we're seeing that in Europe, in the European market and in the US market. And we're also seeing oat milk coming in and taking over segment like verticals like your almond milk, soy milk are just dying down because oats is just naturally sweeter and tastier as compared to these other products. And also that oats goes really well with the coffees and the teas. So selling to a B2B client is actually easy with this kind of a product because it enhances their coffees and their teas that they put in so much effort into selling. So we're trying to create something that's not too overpowering, but also something that, is a value add for our B2B clients to be purchasing these kind of products, not just from a cost point of view, but from a taste point of view as well. The alt market, as we like to call it in India, we're trying to create this whole, this whole alt segment completely based on plant-based products and seeing how we can grow this segment. Right now, in India, most people don't consume these products purely because of the cost. Regular milk's available at 1/10 of the price of oat milk and almond milk, and there's nothing we can do about it right now because there's no way we could match those prices which are of the large-scale suppliers in the country right now. But again, keeping in mind, once COVID came in, people started becoming a lot more mindful and a lot more picky on what they were choosing and purchasing. Online spending just grew tremendously, which gave brands like us a big hope that there is a market for people like us. And also consumers started analyzing and thinking twice before picking up just any and every product off the shelves, because we realized over the last 2 years that the only thing that matters is our health right now, and anything can come in and change the whole world at any time, and we can't do anything about it. So this being a plus has affected the sales in the plant-based industry. People have started moving towards these products, even though they're not into the whole lactose-free, gluten-free. There are still a lot of people that, are against it, but I mean, eventually once they try it, like I said, making that switch isn't hard. So hopefully we can come out with a whole array of products in the next 2 to 5 years, wherein we not only just have all dairy products, but we have food products. Mock meats is something that's growing as well, and we want to take over that entire market. So yeah, this is one of the two products that we have right now in our portfolio. We've tried to package it and brand it in such a way that it stands out on the shelves as compared to the regular brands that are available right now. Kept the color fresh, and we used a couple of agencies in London and Europe to see what best we can do and what competition was doing out there. Considering we were the first in India, we wanted to be very different from what the regular players who add actual images of oats and actual images of almonds on the packaging are doing. Wanted to keep it more millennial friendly, cater to an audience of the age group of 15 to 65 and not just a particular segment, which is why we've gone with these colors and kept it bold and made sure that people understand what the product is, even just in that 10 seconds of glancing by at an aisle. So yeah, that's about it, ladies and gentlemen. This was a quick presentation, but happy to take any questions with regards to this industry if you guys have any, or with regards to these products.
Between now and the year 2030, what's the market forecast for growth?
So firstly, I think that's a lot of time. I mean, I'm glad you said 2030 because that gives this market enough time to grow and also a lot of consumers to, try these products out. The growth is, I don't want to put a number on it per se, but at least I'm sure it's going to be 5 or 10 times more than what it is right now, purely based on the fact that a lot of VCs are moving into this segment and investing heavily into brands like Oatly and Food Lab and the European brands and the American brands, Australian brands. In India right now, it would be a lot more slower as compared to these other markets, as I mentioned. But that being said, it's purely based on, in India, it's more of a cost game. It's more of how we price our products. But in the global market and when we're exporting these products, we're seeing that price is not that big of a factor. And people are open to making the switch. It's just about getting them to try the right product and finding what suits their taste palates.
Hi,
Hey.
thank you. Your products, the vegan products, what are they primarily made out of?
So right now, we've launched the oat milk. The almond milk's launching next
That's
week in
the
India.
dairy, but
Yeah.
do you have any vegan, like meats
So
or things
we're
like that?
we're doing research right now on coming out with mock meats. We're doing sauces and mayonnaise. We're also focusing on ice creams. So we're in the phase wherein the R&D is going on, and hopefully in the next 2 months we'll be out in the
But
market
will it
as
be the
well.
typical soy-based products that are out there, or are you thinking?
No, we're actually using a very different approach with our R&D team.
Okay.
We're working with a mix of people from Sweden
Okay.
and also people in India, purely to see if we can cater to the flavor profile of the Indian market first, which is very different from
Of
what
course.
the people in Europe and we also use a lot of saffron. So we're trying to create local flavors that are already available in India, not plant-based, of course, but those flavors, if we can provide an alternative to them, we want to cater to those flavors first. So it's a mix and match of a bunch of things right now, purely because we're catering to and focusing on the Indian market first.
Okay, but are you considering the health impact of those products? So
Absolutely, that is
soy
top
has-
priority.
Yeah.
Yeah.
Okay.
And even a couple of brands are using sunflower oil in their alt milks. We're not particularly catering to that purely because again the research has proven that sunflower oil not that healthy, not that good. So we're trying to stay away from these things that the bigger brands are doing, but it's taking us a lot more time because we're a smaller company.
Of course, yeah.
Yeah.
Thank you.
Hi, Rohit. You just now said that you are putting saffron also.
We're not putting saffron. We're trying to create flavors for our upcoming products using saffron.
But flavors would be artificial, I suppose.
No, we're trying to keep it all natural. And if it's not possible, we won't be launching it in the market. That is something where our founders and my partners are very particular about. The reason I said saffron is purely because in India, if you see, we get a lot of pista milk and a bunch of other flavors which are particularly for the Indian market. And that's one of the reasons why we want to see if we can create ice creams and flavored oat milk out of these flavors. So we give them that switch immediately because they've been used to that flavor. People are used to drinking pista or these kind of flavors in the Indian market with brands like Amul and Nandini, having majority of the market share right now. If we create a flavor that's new to them, it's going to be harder for us to get them to switch. But if we create a flavor profile that they're already used to and tell them that this is plant-based, dairy-free, we immediately get that market share and get people to try out the products without having them to think twice. Right now, the stigma is that if it's plant-based, only a person who's vegan or only a person who's health conscious is going to go into that aisle, and that's the stigma we want to move away from, which is why we always call ourselves a plant-based company and not a vegan brand or a vegan company.
So this saffron thing is still in R&D phase, I suppose.
Sorry?
Saffron, what you are saying,
Yeah.
saffron flavors, that is still in R&D phase?
It's still in the R&D phase.
Okay. Thank you.
Any other questions, guys?
All right, since no one has any questions, I have one question.
Please.
So you mentioned that you're a plant-based company.
Yep.
But if you remember, Kellogg's came to India. I'm talking about only the Indian perspective right now. Kellogg's came to India and said that we'll change the breakfast habit of Indians, and now it's selling upma in India. Do you think India as a territory, as a market as a whole, is ready to a switch from the natural cow milk or buffalo milk to something like this drink, which
It's
is
absolutely not ready yet, but that's where we come in and that's what we're trying to do. And, so, I mean, while I say it's not ready yet, there are not a lot of people that are actually aware of, a person like you consumes milk, I assume, on a daily basis, right? I'd request you to try any of the alt milks available and see how it works with your digestive system, how it's lighter for your body per se, and how it really affects your day-to-day activities. Because that's the only way people are going to switch to these products, is if it personally impacts them in any way. Even if a person next to me trying something new tells me to try it, I won't really try it unless and until it has that immediate impact on my body. So it is, like to answer your question, India is not ready, but there are a lot of people that are ready to pick up these products provided they get enough information about it and like the taste. If they don't like the taste, regardless to how healthy it is, the Indian market, they're not going to make that switch, which is why R&D is very important for us, and we're taking our own sweet time to launch every SKU one at a time, establish it before we launch the other one.
Thank you so much.
Cool, guys. Thank you so much. Any other questions? Cool. Thank you, guys. You have a good one.
Thank you so much, Mr. Rohit. That was elaborated and very well answered. So without any delay, let's jump on to our second fireside chat for the day, which is based on how value-based. Sorry, not able to hear myself. Yeah, now it's working. Sorry. So how value-based innovative procurement unlocks resilient health systems. After pandemic, the need of the hour is to come up with better healthcare and better health system resilient and which are financially sustainable to ourselves and very much firm so that we can move forward. This can be achieved through value-based innovation, procurement of a medtech. To explain further, I would like to invite the expert speaker, Nagarajan Chakalam, Director of Maitri Drugs Private Limited, and Samir Khan, founder of Lighthouse Innovations Ltd. Kindly come forward. Thank you.
Hello? Yeah. Okay. Welcome, everyone. Thank you, and maybe we can sit here. Sorry about that. As you know, all of us are just getting adjusted to, in-person events after 2 years of staying home and looking at screens. So please bear with us. I'm Samir, coming from Oxford, and this is Naga, my friend, from India. And we're going to talk about a slightly technical topic, so please again bear with us, but it's not going to be technical. We'll try to keep it as light as possible. Let me just open the discussion with a little bit of a background. We talked about food security, climate change, all sorts of system level problems, and then now it's health. But ultimately, I think it's fair to say that we all are rediscovering the way we value things, right, around us after the pandemic. It was fairly said that we're all concerned about health. So rightly so, this topic is about how things are procured in the healthcare and how we are putting new value to things, right? So how people are putting some sort of new measurements of value in the way things are bought by the healthcare system or the pharma life sciences sector. So maybe we can begin with our introductions quickly.
Sure.
Nada?
Can you hear me? Okay. So thank you, Samir, for breaking the ice here. Am I audible?
Yeah.
Okay, good. I think really glad that we are meeting in person today. I really want to appreciate you all, Health 2.0 organizers. It's been so long that we have met online, and I'm so glad that we are not in front of Zoom screens or Cisco WebEx screens. So let's begin with our introductions, okay? So I'm Nagarjun. I'm one of the directors of Maitri Drugs Private Limited, a bulk drug manufacturing business based in Hyderabad, India. So we manufacture active pharma ingredients in a US FDA approved facility. We have 65 plus products, and we have 35 US and actually worldwide patents. We have 10 EU CEPs and roughly 36 US DMFs filed. So that's a short brief of our company. Coming to my role, in my current position, I oversee and manage end-to-end business operations related to supply chain, procurement, and finance. So that's where my experience is going to bring me closer to the topic at hand today.
Perfect. Thank you, Naga. And
Yeah, you can.
is
go
it
ahead.
working?
Yeah.
Okay. We'll keep checking that, and also keep a check on you guys. So I'm Samir, as I said, from Oxford. So my story is I came to the UK to do my studies, PhD, and got into life sciences. And then since then I was heavily involved in the healthcare system in the UK, the NHS, the infamous NHS, the mother of all bureaucracy in England, as they say. And most of my work has focused around health economics and value-based measurements, metrics for new technologies and innovation. So anyway, so I started my own venture recently, the day before the lockdown happened, called Lighthouse Innovations, where I help startups and SMEs and pharma companies to solve the same shared challenge, which is how to get into the bloody healthcare system. So maybe we can just kick off quickly.
Yeah, I think it's good to notice that we are coming from completely different ends of the spectrum here. So
That's
it's
right.
going to be a very interesting conversation for our audience here.
Well, I hope that it brings some kind of direct or tangible benefit for you to listen. So,
Right.
Naga, if I can start by asking you, focusing on procurement in life sciences, pharmaceuticals and drug space, how does the landscape look like?
Sure. So procurement and pharma manufacturing, that's where I'm coming from, right? So basically, you'll have procurement of raw materials, procurement of civil services, and procurement of all the ancillary stuff, right? Like analytical equipment and all the chemicals that you use for manufacturing. That is a basic procurement. And on top of that, we also are responsible for me and my team. When I'm talking about we, I mean my team and I. we are responsible for nurturing vendor relationships and also negotiating supplier contracts. So that's a brief about like what procurement looks like in life sciences industry. But to set the stage, just to have a foundation for the rest of our conversation, let me bring in some more specific stats here. Okay, so for the pharma manufacturing, all the raw materials that are consumed, I'm only talking about Indian pharma manufacturing here, 70% of the raw materials are imported. So 70% of the raw materials that are consumed in pharma manufacturing in India are imported. And out of those 70%, 50% of it is coming from China alone. So that's the extent of procurement that we see in life sciences or like pharma manufacturing in India. Last year alone, last financial year that has ended in 2021, $3 billion worth of raw material was imported. So when I say raw material, it is key starting materials or any other intermediates that goes into the active pharma ingredient manufacturing. So that's the scale, that's the extent. So I have like a ton of anecdotes to share that is going to show how value-based procurement is going to help in building resilient health systems.
Wow, that's already so insightful. I never knew that India, such a resourceful country, our country, I mean, it's fair to say, and we import 70% of the raw materials.
70%.
But let me throw another stats at you, just to give the healthcare spin. So in the NHS, you've got more than 80,000. Oh, you can't hear?
That's what I was worried about.
Hello, can you hear me? Yeah, everyone? Okay, perfect. So so I think in the NHS there are more than 80,000 suppliers of materials, including drugs, lab stuff, and what have you, which is relevant for the medical industry. And 60% of the UK's carbon emission comes from the NHS procurement itself. Actually, no, 60% of the NHS's carbon emission comes from procurement, from supply chain. And NHS is going through this whole overhaul to measure that carbon and really identify where are the sources, what is happening, right? Even though, and here's the tension point. So UK's public sector transport is one of the most mature and really well established and successful, but turns out it's the same problem creator for the healthcare because there's a lot of carbon emission. So just to bring it to relevance to everyone here, that there's a system challenge here, right? So what do you procure to reduce your carbon emission but also provide the patient benefits, for example, the health benefits?
So I'm just curious, what drives value in such a vast procurement space?
Yeah, well, I mean, historically, the value was never measured in totality because there was not much data. The only data we had was the doctor's prescription and some of the episodes of patients recorded at the hospital. So things were recorded in a reactive way, right? So if you turn up at the A&E or emergency with an episode or an accident, that is the point where the data was measured. And that was the only stats that was used by commissioners to put a budget on healthcare. But I think now, in this era, when you've got so much of real-world data, through Fitbit, through people measuring their mental health episodes, all sorts of stuff. So now the data regime has become so huge. So, eventually value has been redefined in terms of procurement in the healthcare space. But I think it's still sort of formative years. It's still, a long way to go. That's the state of affairs.
That's interesting. Okay.
So,
that's what I'm coming about. Like I think in life sciences, right? Like in pharma manufacturing, I think value per se for the industry. I don't know if it was measured at any point in the past. But there are definitely some factors that will influence the value that is captured by any pharma manufacturing business. So the value comes from four different aspects. So one, of course, like the cost for sure. Like I think that's pretty common for any industry. So the cost of the raw material that you're procuring. It doesn't mean that you have to procure it from the low cost provider. That's value based, right? It comes from quality. So like I mentioned, we are a USFDA approved facility. So the quality requirements are so stringent that you should have your product meet some specifications, and the purity level of the product should be, I mean, not just 90% or 95% or 99%. In some cases, you have to go to like 99.99%. So quality of the manufactured product. Also, it depends upon the quality of the raw material that you procure, right? So you can get to that quality only when you have that quality in the raw material that you procured. So that's the second aspect. The third aspect is the service. So when I say service, I'm pretty sure this is pretty common across the healthcare spectrum, I guess. Timely delivery of raw materials. So we do set some expectations with our customers saying that, this is the lead time for us to manufacture this active pharma ingredient or this bulk drug. And to meet that expectation of our customer, it is very, very important for us, for our procurement team, to get that raw material in a timely manner. So not many companies do delay the supply of their raw materials, but it is nevertheless it's very important. I mean, COVID has multiple examples to showcase that there have been so many delays. So that's the third one. And the final one is the payment terms. So sometimes many pharma manufacturing companies, right, in India, they are having some sort of negotiating things with their vendors to have very flexible payment terms. So if there is a supplier who is giving you the raw material for 90 days, he might charge you a little bit premium. But if there's another supplier who is supplying you the same raw material, same specification and everything, but with a flexible payment terms, I think many pharma manufacturing companies would prefer, getting it from that source. So I think those are the main four drivers of value in API manufacturing.
Really interesting. So let me ask everyone a question. Has any one of you heard of the pizza dough challenge? Have you ever heard of the pizza dough challenge? No. Okay. So so we are talking about, let's say, APIs and drugs and raw materials for medicine, and you talked about timing. Right. And let me just give a flavor from healthcare perspective, how timing is really crucial. And now that you've got digital technologies and AI and all sorts of softer technologies, it's very hard to predict and very hard to measure or have a standard. And that's precisely the reason a lot of the systems are struggling with standards. But let me just use the pizza dough challenge here. So say for example, you've got a bunch of college students turning up at a pizza restaurant on a Friday. How does the pizza making shop plan on a Thursday night with its fixed fridge space how much pizza dough should he get ready and put in the fridge? Because if he uses too much, maybe it won't fit in the fridge, or if he uses too much, it might be wasted because not many people turned up. And that's exactly the challenge of timing and prediction in healthcare. We all talk about a robust business case for having enough patient flow. But I think COVID just completely, changed the equation, because you had too many people in the emergency and then too many people at home waiting for elective care, things like cancer diagnosis or diagnosis of diabetes, which were sort of, compromised. And then the healthcare's job was to predict how many patients do they have to deal with, or what's the size of the demand. And I think that is where procurement suffers, because if you do not have a clear logic and a clear strategy, you do not know what to procure at what time. So just giving that kind of analogy of pizza dough, and I'm sure every industry suffers with this demand-supply problem, right? But it's just, even in a country like UK, where the public healthcare system is well established, I think one of the challenges that we face is a trade-off, a sweet spot, trying to figure out a sweet spot between taking the risk on new technologies and adopting them versus measuring the value in them. And there's a faction of the healthcare people who are obsessed with measuring the value. Like they're busy making an academic career out of that. Versus there's other people who are just, on the other end of the spectrum, who want to make the fastest money on a new piece of technology, right? And they want to get the cheapest stuff into the system so that they can make some cost savings. And this is where I think in the UK the challenge is, like, how do you hit the sweet spot so that you can balance it out? Because those are two extreme views. But let me ask you one more question. What do you see as a challenge in the post-COVID recovery phase, especially for procurement in the life sciences sector?
Right. So let me first say some of the challenges in the procurement specifically, and then I'll talk about how COVID has impacted. So the biggest challenges in procurement in bulk drug manufacturing and life sciences is that it is not very easy for you to switch the supplier. So like I said, if you are selling your API to regulated markets, you are scrutinized a lot. So for you to have all the FDA approvals, you need to put in where you are procuring your raw material from. I mean, if it is a key starting material or an intermediate. So you have to put in that information into the FDA system, and they'll review it. I'm not exaggerating, but there's like tons and tons of files that you have to do, right, when you're submitting all those regulatory filings to US FDA. When you want to switch the supplier, it's like another ball game altogether. So you have to again notify FDA. You have to notify your customers who are purchasing the product that you manufacture. So I think that is the biggest challenge in procurement in general in life sciences. Coming to COVID, I think we have all seen, right? I think all industries. I'm pretty sure even in the healthcare delivery that you have already touched upon, longer lead times for sure when you're procuring it from abroad for your raw material to cross borders. Longer lead times, we have seen that, and price inflationary pressures. There have been so many changes in the prices of the raw material that we have procured. And interestingly, when you are, so we are generic manufacturers, when you are making a generic product, the competition is cutthroat. So there is no scope or very little scope for you to pass on the price increase of your raw material to your customers, because there's already a competitor out there who wants to sell the product at the lowest price possible. So the API bulk drug manufacturers are always squeezed in, especially during the COVID, right? We have seen the price jumps, and the product that you are selling, the price will not reflect the new raw material price. So that's the second aspect. The third one I would say is increased freight costs, since we are importing from China. The freight costs have gone up. So that was the interesting challenge again for us to address. But the most imperative thing that I have noticed during the COVID is not just my company, but in general the life sciences industry. What I've noticed is all the supply chain managers are now more vigilant, because they recognized the lack of visibility or lack of information at hand for them to prepare for any sort of unexpected events. So that was one change actually, and there are a bunch of other changes as well, when you're procuring from foreign countries, delays are inevitable, right? I've seen companies procure the same raw material locally, although it is challenging for them to go to FDA and supply all the required regulatory documents. But I've seen many companies do change their supplier. They have basically shortened their supply chain, right? So I think those are the big changes.
Yeah,
I
so
would
that's
say.
very interesting because I can draw some parallels from healthcare as well. So in the UK, in the NHS, for example, there are funny dilemmas that happen. So number one, from COVID, during COVID, what happened was obviously there was a panic attack in the system, right? And so a lot of procurement happened randomly, or at least with kind of a top-down approach, right? Like, the government intervened and we procured lots of PPE material, lots of other stuff for critical care, for emergency care, right? And the elective care was sort of, in a way, ignored to some degree, or not mismanaged, but let's say under-prioritized, deprioritized, right? But then the procurement is looking at critical care. Now, what happens is in the industry, on the supplier side, is that trying to shoehorn your technology into the system, everyone started putting their value propositions into critical care. And so it's quite funny that you could see the black and white. Like, if I have a Fitbit which will keep me healthy, there were propositions which are trying to sort of, tailor that all the way to critical care. And ultimately you can say that if you behave healthily, then you're going to prevent your stay at the hospital, right? So that became evident. So, what the digital technology industry has been saying for the last 10 years, it just happened within 2 years. So I think that was quite beautiful.
That's true.
But I think coming back to the cost management and the speed of procurement, I think that's also true in the same way. People have now realized that the process should be more lean, more agile, more adaptive, because a lot of the process is not working, and we are just bookkeeping and dealing with the bureaucracy just for the sake of it, but actually it's not delivering patient impact. So this is where I think some kind of awakening is on the positive side.
That's true. I think cost versus responsiveness, right? Like not just like chasing the low cost supplier, but you want to have a supply chain or the procurement industry or procurement team finding the supplier who is going to be more responsive to you. I think there was a trade-off earlier. I mean, like you rightly said, right? I think all the manufacturing shifted to this just-in-time paradigm, right? So I think Toyota in the 1950s, 5 decades before, they started this just-in-time strategy for inventory management, and now they are also pivoting away from that, right? So I think it's good that you touched upon how not stacking upon raw materials is
Yeah. And so, so what would you say, looking at the future, what would you say will make procurement more value-based, and that sort of leads us to a resilient health system? Right. How would you break that into an answer?
I think, see, one straightforward, one obvious way to make any health system resilient, right, is to have all your inputs sourced for the infinite amount of future time, right? But that clearly is not very efficient, and it is very expensive too, right? Even in the manufacturing, you cannot have all the raw materials procured and you can just say I'm going to make my procurement resilient, or I'm going to make my supply chain resilient. You cannot do it. That's the least preferred way. Couple of other options would be you can shorten your supply chain, but again it has its own cons, right? If you see the history of the world, most of the prosperity that all the economies have derived was through globalization, right? Each country working in tandem and with those partnerships and collaborations. whole world, like multiple countries have seen,
Is the
all-
buy-sell side of the market, I guess.
Correct, exactly. Right. So I think that's the con, but to be more resilient, that's one option. Biggest thing for any supply chain to be more resilient is to have proper and right access to information at the right time, right? I think lack of that, right? Like lack of that information will make you a little less resilient. You cannot prepare for once in a lifetime event.
Yeah,
right? It's
I
hard.
totally agree. I think in healthcare, for example, I strongly feel, coming from the health economic side of things, that your metrics are of no use if all the people in this room do not understand what you're measuring. So I'm kind of also of the view, and many people in the UK are of the view, that there's this over obsession with metrics and measurements and making an academic career out of it, and it doesn't serve the purpose. What it serves is another bureaucratic layer in the system. And now I think with the invent of digital and smart and AI technologies, there's a very interesting trend we see in the UK. I don't know how much of it is true in rest of the world, that a lot of the leaders and innovators are coming up from the minority, from the neglected, or from the how do you say, economically deprived sections of the society. It's a very interesting fact. And because they saw the problem in the system, they saw the bureaucracy, they saw all the pain points, so they leaped for it, and they went to the innovation, and they are coming up now. So now there's a new social paradigm which is being considered in the NHS now, which is completely non-health related. It's actually equality of access, which is that did this and this and this ethnic group get equal opportunity to innovate and to procure stuff? Or did we, when we procured 10 things for this hospital, did we sign up the contract with only the affluent class, or did we also source stuff from the local and the deprived? So I think there's a new focus there, which is, I think I would really welcome that kind of change. Yeah. But I think then the last point I just want to make is timing of the metrics and the procurement is super important. Because when you're procuring for COVID, you put all your energy and effort into critical care, and then the elective care suffers. So how do you trade that off? And if we went for the preventative strategy, none of this would happen anyways, right? All the patients will be moved to elective care. Nobody will be in the A&E because no accidents will happen. No diabetes will turn into a hypoglycemic episode. So those are the points I can see from healthcare perspective.
Building resilience, that's true. I think it's interesting to see how people are going to change, because it has prepared, right? Like I think COVID has prepared everyone. So like I already mentioned, supply chain managers are more vigilant. Earlier, people used to take this reactive approach to manage any sort of risk. Any risk, they used to be like very reactive. But at least now COVID has taught us, all the procurement managers, to be more prepared, and there have been like many formal mechanisms that were put in place just so you will be a little bit more prepared for you to handle all those unexpected events. Again, all that can happen when you have proper access to information rather than focusing on all the nonsensical metrics, I guess.
Yeah, thank you. So how are we doing for time? Right. Hello.
We can start on Q&A.
How are we doing for time? Do you think we should open it for the questions to the audience? Yeah? Okay. Well, we have a lot of time, but I would rather have people from the...
Let's make
Would
it
you
interactive.
Agree? Make it interactive, and you might have nice thoughts to share. I know Raman, for example, is a local hero in procurement. We've just heard some amazing stories from you, Raman. So would you like to say something?
I think the mic is with me.
Oh, please go ahead. Okay, you go ahead.
Yeah, my question is for Naga. Hi Naga, I'm Suman.
Hi, Sumant.
Yeah, when you were discussing about the resilience, you said like we cannot prepare for a one-time eventuality like COVID, right? What I believe is it is a kind of suggestive thing. Why don't we look it in a different approach? See, the main problem that we are seeing when it comes to procurement is one vendor dependency. Either it can be dependency on China or any other country. We are depending so much on one vendor or something like that because we are giving our commitment to the regulators. If you see few decades ago, Walmart had taken an approach. So Walmart never procures anything more than 2.8%. So if they have to take tomatoes or any kind of supplies, they won't get it from one single vendor. So if you open the same concept even for the procurement, you can depend on Brazil, you can depend on US, Europe, Asia Pac. So from everywhere you can get the supplies on time. If one area is affected, for example, China is affected, so the entire world is affected. The reason is APIs, raw material, excipients, everything we are more dependent on them. If you decentralize and diversify the markets and strategize your procurement, I think that would
That's
help.
totally true, Sumant. I'm glad that you brought this up. Actually, I said, right, like earlier people used to be reactive. Now they are a little bit more proactive, not settling down with just one vendor. Every industry, even pharma manufacturing, they are trying to diversify their supply chains, not just having only one vendor who is supplying that raw material to you, right? So there have been initiatives, even in my company, we are not just having only one vendor in place for specific raw material. So diversifying supply chains is for sure a better approach for you to be more resilient, no doubt about it. But like I said, it was happening, it was not happening before, it just started happening.
Just started.
Yeah, and the other thing that you mentioned, the Walmart example that you gave, there's a little bit difference. It's not apples to apples because Walmart is like I don't know, it's like the least regulated market, I guess. But when you're talking about pharma manufacturing, it's the medicine that, you know, at the end of the day is being consumed by humans. So maintaining all the standards, the quality specifications are paramount. So you need to be very sure when you are, you know, having an alternate source in your diary. So I think it's
I understand
very
that.
important.
One question here. See, it's only the perspective of the regulators, right? See, if there are 10 vendors, if they are supplying the raw material with the same quality, which falls under the specifications, anyhow, even it is coming from an approved vendor, when it comes to your manufacturing unit, you will do all the testing.
For sure, for
Right?
sure.
So you will do reduced testing if the once you start procuring from the same vendor for multiple times, you may get into reduced testing,
Right.
but you will definitely test, and if you see that whether it is falling in specification or not.
That's true.
If it falls in specification, it is good.
Yeah.
Like good comes in, good goes out.
Right, but to do all that, you know, you have to spend so many resources, right? I think people will start doing that. I'm pretty sure people will start doing that. Even governments, right? Like in India especially, government has been more active. They have been initiating many schemes. So recently, to reduce dependency on China. So, you know, they are trying to like shorten the supply chain. So there have been a $500 billion worth of initiative to construct a bulk drug park in India. So, and there is also like, you know, I think close to like $1 to $1.5 billion. I'm not entirely sure about the number, but it's a sizable amount that has been, you know, sanctioned to encourage more make in India kind of a thing, like, you know, to have less dependence on foreign countries. So I think you rightly said, like one thing is to shorten the supply chain and the other thing is to diversify your supply chain.
Right.
So if these two things happen, and I'm pretty sure that's going to happen more frequently in the future, the only reason I don't think that has happened in the past is, you know, it takes some amount of resources, right? You
Got
should test that material, you have to put them into your approved vendor list, you need manpower, you need time, you need money, everything. So, but people will start doing. I'm pretty sure people will start doing going forward.
Yeah, thanks for it.
Sure.
Thank you for your input. I have 2 cents. One is the statement, second is the question. Statement, because you were talking about value chain in procurement, right? I think that's very important, and I echo what you said, right, in terms of how the procurement is going to be measured tomorrow. It's not based on the cost savings that we are going to deliver. Cost is definitely one, but how, as value, we can deliver. Number one, how we can enhance the patient's journey, right, in the hospitals. Transparency in systems, agility. These are few examples as a value chain that we are talking about in future. Procurement is going to be measured, right? Now the question to you, Naga, because you came from a pharmaceutical manufacturing, and
Right.
it's very touchy to me, and I'll be very blunt in my question. When it comes to a pharma domain, it's the most corrupted industry I've ever seen, reason being, because I was just mentioning to somebody in the morning that the system is corrupted. It's very irrational that the consumer do not choose what they take. It's the manufacturers or the top layer which decides what a patient is going to take, right? So as a procurement professional, what do you advise? Where do you see the future? How you're going to drive that change where consumer has a choice to take what medicine they want to take, and it's not the doctor.
I think there's going to be a lot of technology adoption, and there's going to be so many changes that will come. Corruption point of view, I think it's going to be very decisive topic to extend along that thread. But to answer your question, how consumer at the end of the day is going to benefit is, in the future, I think there have been many R&D projects that have been running, right? Like gene editing is one technology where you can target a specific patient. So personalized medicine, I would say, so the personalized medicine, when it comes, it would be, be more specific to the patient itself rather than having one drug for the entire therapeutic category. So today that drug might work well for one person, but when the other person is consuming the same drug, it might be a little hard for that medicine to target the microorganism. But in the future, to answer your point, I think personalized medicine is going to be the answer.
Can I also answer the question as well? Let me, him, and you work on the corruption.
We should.
and change it, right? But I think, just to add a tiny bit of my pharma experience. So I've worked in rare diseases, therapies, and then I've worked in highly kind of most generalizable diseases and infections as well. And the industry is divided on that. And then, then the new stuff that has happened is that at least relatively you can, it's fair to say that the patient and the consumer has got some voice now, like to some degree you can say the social media has given you some voice, right? Like on a relative scale level. And I think that is working, and I can see that the pharma industry and there's a big divide between biotech industry, the booming startups in biotech, and the established incumbents of the pharma world. Because ultimately the biotech is leading the race. I mean, BioNTech, for example, is a great example, right? And thanks to the CRISPR technology, which changed the way we design drugs for cancer or other rare diseases. And those guys are absolute advocates of affordability, because they come from, the scientists there are coming from emerging, economies who realize that our populations suffer from the affordability issue, right? So there is a bit of a reputational race, actually, between the biotech and the pharma. And, like, for example, I use this example. In the UK, if you do not see any process working of an application for immigration or anything, go on Twitter, and immediately there'll be like a follow-up very quickly, like within microseconds. So there is some hope, I would say. And procurement's not totally, I think it's all getting disrupted, right? From top to bottom, everyone's busy trying to really, deliver some value or define value in a new way. So I'm still hopeful that, it'll change for the good.
We might see our kids will enjoy that time.
Any more thoughts? If you even if you don't have questions, any thoughts from anyone to add? How can we change the future of the hospitals? Or change the future of the biotech industry?
Yeah. I think just as everyone is, I'm pretty sure, we are equally, if not more, curious to see what future has in store, I guess, right? Like, at the end of the day, procurement, right? Like, people have to think the core need of it. What do they need, right? Like, to answer some of the questions that raised, we should understand, do we really want it to be like more resilient, more efficient, or, all of those together? We should stay focused and see what future has in store for us.
For me, I think one of the major conclusions is that the influence on procurement in future is going to come from the non-health sectors, for example, because data is going to grow. Big data is here. We now are going to understand what's the environmental impact of the ambulance, for example, right? We know that. So someone is going to come in and do a startup to change that, right? It turns out the same problem solved can also keep the patients away from the hospitals, because if you, in your business, I'm just throwing an idea, in the business model, you throw in the idea that you bought bikes, you offered free bikes to the people who are living very close to the hospital. So, there's going to be system level interventions which might change the way we approach healthcare. And I think that's going to be, and only data can support that, because everyone wants evidence. Ultimately, it's all about patient risk, patient safety. So, if that is not compromised, then people can play with all sorts of business models. So I feel that there is scope for that, and data is going to play a big role in terms of, bringing in the intangible system close to the healthcare.
I will keep this.
Excuse me, sorry, there's a question from the audience. Can you please provide the mic? Thanks.
I can raise one more question first,
Okay,
so
why
Naga,
don't you go first?
Yeah, sure. So Naga, is to you, because we talk about patented drugs thesis, right? And we also talk about the biosimilars of patented drug. So where do you see, if I talk about UAE, there are only few countful manufacturers, right? But in India, we're talking about more than 200 generic producers, right? So where do you see that word is going in terms of a right switch to a patented drug to a biosimilars?
You're comparing UAE to India, if I understand your question right.
General switch.
Okay.
Drugs which are patented,
yeah,
and then switching that to biosimilars.
Okay. So biosimilars and generics both are pretty interchangeable, right? Like, when it is a chemical process-oriented molecule, it's a generic medicine, and when it is a biotechnology product, it's a biosimilar. So most of the patented drugs today, as far as I know, they are coming from the United States today, right? I think most of the research still is happening in the United States, and I'm hopeful at some point that is going to change. And I'm thinking, and I want to see India also develop more innovative products, more patented drugs. But unfortunately today there have been very few, I would say only a handful of innovative products that were developed in India. I don't know if anything has actually qualified the clinical trials phase also. So they would, so I think the reason for that is like money, right? Like, when you see a medicine, the cost of a generic medicine in India is like 0.1% of what it would cost in the developed countries like United States. So that is bringing in so much money for United States companies to, take that risk and experiment and, come up with the innovative medicines or the patented drugs. When it comes to India, I think that is the main bottleneck in my opinion. But I don't know, maybe in the future it has to change. I would want to see an India where more research happening and more patented drugs are also released from India. I want to see that. Did that answer your question, or you have more follow-ups?
Sorry, question?
Yeah, it's not a question. This is regarding the resilience that we are talking about. See, we have this pandemic as an example. If we see how we have come up with pandemic experience, nobody would have ever imagined that we would have around 7 to 8 successful vaccines.
Can you sort his mic out, please? His mic's not working. Yeah,
But
sorry.
I think go ahead. That's
Yeah,
Go ahead, go ahead.
I think if we realize we have around 7 to 8 successful vaccines delivered in few months' time. If you go by books of the regulators, it will take around 10 to 13 years, right? So the resilience part we have already shown to the world.
Yeah, yeah.
Now we have to sit back and see what we have done right.
Absolutely.
There are no failures. True. I've never heard like, okay, this vaccine failed miserably.
Well, we still do not know, let's say. But
Yeah, I agree.
In all fairness,
Also, if you remember, all
I've
those
lost my
vaccines.
volume, I think.
Sorry, go ahead.
Hello?
Yeah.
No, don't think it's working. Oh, now it's working. Yeah, so what was the question? Sorry.
It's not the question. I'm saying we have already shown the resilience.
Yeah.
I think we should sit back and understand what we have done right.
Absolutely, yeah.
And whatever redundant works, like even the regulator side, they have to analyze what is the redundant things that they have avoided this time.
Absolutely.
Manufacturing side, what manufacturers had reduced the redundant things. Researchers, what did they have done right?
Yeah.
So right from regulators, researchers, doctors to patients, everyone should sit and understand what they have done right in last couple of years and try to replicate that. I think that will bring the resilience. to the-
Totally true,
Absolutely,
Sampath.
and I think so if I can maybe respond, I think we discussed this before, right? So I was talking about making it more agile and adaptable, and guess what? Actually, one of the first steps I would also recommend the regulators, and which I think some of the regulators are doing it, is to bring in the user right early on and make it more human and user centric, right? Get them into it. So in the UK now. It's fair to say that there's a big positive trend to not shortlist any grant applications for funding for startups or established ideas if there is no patient voice or there is no public involvement in it. So in the design, you have to propose that. You have to because guess what? We are the people who actually showed resilience by taking the vaccines. We took the risks, right? So I think that is the answer as well.
Let me add something on top of what Samir just said. Sampath, I think, first we both should talk. I think I can share more stories and, we can talk about how resilience was built into the system. Talking specifically about the COVID vaccines and how it was authorized, right, it was like emergency authorization. So I think they cut short many steps to authorize the vaccine. Many people, I think the world sees vaccine was the turning point for COVID, right? But what I feel and what you also feel based on the question that you asked is, I think the COVID vaccine itself is also a pivotal moment for any approval going forward. That is for sure. I think we'll have so much to discuss, so we'll chat offline.
Fantastic. And you have got a question? Sorry.
Hi, good evening. Actually, I would start with thank you for the...
Sorry, we can't hear you. Can you make it louder?
So I would like to thank you first for this session. And I think it's an extent to what Dr. just mentioned. We have seen that COVID pandemic prove us that we can shorten some of the steps. We have been heard since the morning about the medicine perspective of the healthcare. We haven't heard from tech people, what motivate us to continue work in healthcare if it's not gonna finish within a year or so. I cannot wait for 12 or 10 years to my app to be approved in healthcare. So do you think in the near future there will be a way to solve this problem so that tech people, AI people can motivate to work in the future?
Yeah, absolutely. So there are some good trends to just, illustrate your point. Like in the UK, there's this famous agency called NICE, which approves drugs. And, it's not at the initial clinical trial level. It's after you've done the clinical trials, they see your evidence, they look at the health economics, they look at real world evidence, then they give you conditions on price, negotiate price with you. That takes itself 4 or 5 years, right? So there were patients suffering from cystic fibrosis, whose lifespan is only 17 years, and 4 years were lost in just getting this drug approved. So just imagine, right? But I think now the systems realized in the UK that this incumbent agency is not working. We need to, and especially for digital technologies, it doesn't work because it doesn't have a framework. And everyone associated with NICE is trying to shoehorn the logic of drugs on the digital space, which is, it doesn't apply. It's like you said, apple for apple. It isn't like that. Even diagnostics are different. So they created different parallel routes. They started creating things like Accelerated Access Collaborative, which is saying that we can have shortcuts through NICE, even though we will work collaboratively with NICE, but there will be shortcuts. So there are 2 or 3 things that are happening. But I think fundamentally in the UK, what is a boring reality and confusing reality, but at the same time helpful, is the decentralization and fragmentation of leadership. So not one single entity decides. So, it's not top down and it's not bottom up. It's somewhere in the middle, hazy, kind of blurry. Like, who decides? You just you keep wondering, do I talk to the hospital commissioner, or do I talk to the regional council, or do I talk to the national head of NHS? It's a bit of an exercise, but I think once you've got your head around it, you've already done your hard work. And I think it's made to be like that. But I think there are faster routes coming. And FDA has got some faster routes as well.
I think it depends, right? Like what our friend here has told, right? Like all the experts have to get together, they have to discuss, they have to see what brought, COVID vaccine approval so fast. I'm sure many stages are going to flood with these sort of discussions now going forward. So once all the industry experts have their opinions, I think the approval process and everything is going to cut short down.
Thank you very much for the great talk. You spoke about decentralization, and that makes me think of blockchain technology. And how do you see that in the future of healthcare and with procurement in specific or healthcare in general?
Should I go? So I think like digital technologies, like artificial intelligence, this is another buzzword in the mix of things, right? And I think regulation is trying to play catch up with innovation. So, one thing is to educate the regulators with these things. Some people are doing a phenomenal job at it. Some people are, from the innovation side, I can see some startup CEOs and some SMEs trying to really, address this challenge of translation indirectly. So building partnerships, for example, going to the UN level and joining some working groups there to address the regulator indirectly or passively from the back door, from the top down, to say, look, I'm coming from WHO and giving you the directive to change your regulation for blockchain in England, and I'm coming from WHO, so you better listen to me. So you see, that is quite a nice, you're playing your creativity to influence, but you have to translate and influence the regulator. It will take time, and I guess it will change, but things are happening. Some of the stuff in blockchain was already implemented 10 years ago, but it was not called blockchain. So there's also that. In the UK, in the procurement, there were some regional commissioners or commissioning frameworks which already used the basic framework of blockchain, of decentralization, but they didn't incentivize it. They didn't use the financial instrument. So yeah.
Talking about it in general, I think it's going to come. I'm sure it's going to take time. in the wake of all the regulatory body. But what I feel is it's going to be there for sure. Blockchain will be implemented. I recently met someone from Germany. They actually are working on something called blockchain for supply chain. I've read their journal. But once that is implemented in the supply chain, I'm pretty sure things are going to improve because there's going to be like a lot of visibility, a lot of decentralization, like you mentioned, which will improve things faster and even make these health systems even more resilient.
I just had one more streak of a thought on that. So again, taking a UK example, right? So I think by the end of today, it'll be nice to say that this audience understood the UK's market, at least from my side, right? So the behavior of regulators in every system is also driven culturally, is also driven by the culture of the land, right? I'll give you a flavor of UK. If you go directly to the regulator and say blockchain, they'll reject it. If you go directly to the clinician and talk blockchain, they'll turn their eyes and in gaze and turn back, turn their backs at you. But if you go to academics and write 3 white papers on blockchain with the clinician, boom, and you say that Professor Robert, you can sit on the stage and talk about blockchain with me. And the guys in the industry and the space are going to listen to you. That's it. You've done it. So that is the kind of voice you need to create. And that is where UK stands. It's just it could be absolutely silly to the extent that you did that for anything and that sells. But if you came up with the best evidence in the world to support your technology and went directly with your chest high to the regulator, they didn't listen because, at the end of the day, they'll walk into the Sainsbury's and ask the professor living next door, do you believe in that blockchain? And the professor, no, I don't. So that's it. He'll disapprove it. But I bet the same happens in India as well. We all do that. Yeah, we all have our friends to ask, right? What do you think of this? Okay, you think 20p? Okay, we'll procure it. I think there's a bit of a reading between the lines to understand the approach of engagement, I suppose. But should we end on that note? And
I think it's a wonderful.
We've talked a lot, but thank you so much for being patient with us.
Thank you.
Thank you so much. Wow, it was really interactive. That's the best part about these events. Sorry for that, it was an update. Anyways, it was really interactive and I really liked it. Let's disperse for a quick tea break as it's really chilly over here, and we'll be back after 15 to 20 minutes break, okay? Thank you.
Hey there, I'm Natasha, and my specialty is making all your app building dreams come true. Say you've got a
It's about the sun, it's about the world. It's about the sun, it's about the sky. It's about the world, it's about you. Spinning around, it's about the world, it's about the sky. It's about you, it's about me. It's about you, it's what you want me to be. What you want me to be. What you want me to be. It's about the sun, it's about the world. It's about the sun, it's about the sky. It's about the world, it's about you. Spinning around, it's about the world, it's about the sky. It's about you, it's about me. It's about you, it's what you want me to be. What you want me to be. What you want me to be.
você está fazendo como corpo? O que você está fazendo? Eu acho que tudo volta ao começo. A gente gosta de mar, de mergulhar em nossas águas. A solidão é ruim quando eu não te tenho. Meu pensamento é ruim. O que você quer? Cadê você? Passei na vida esperando teus beijos. Além disso, teus olhos falam, te temo. Mas eu só quero acabar contemplando teu sonho. A lua cheia fica aqui, embaixo nossos pés. Eu preciso de você.
Eu preciso de você. Eu preciso de você.
Brain on fire, drown my sorrows, wipe the tears. Honey, eyes are melting. Your sharp words that you fade away, bring them back to life. And how could I be blind for such a fool? My wound is growing every day, but somehow I'm not afraid. Time is friction in our bond. We just got our paper bone, running out of ink. They won't return. Brain on fire, drown my sorrows, wipe the tears. Honey, eyes are melting. Would you take a necklace night as I dive into your mind? Get in my collection twice. How could I be blind for such a fool? My wound is growing every day, but somehow I'm not afraid. نسيرة نتخر ما
Pop, drop, drink. Feel the daily protection with Redoxon.
Gonna wear that dress till I
So we are kind of back. Great to have you all back. I hope you're having a great time with us, learning and establishing connections with the brightest minds in the healthcare, the F&B, and nutrition sectors. Continue with the learning streak. We will be kickstarting our fireside chat on the topic of the rise of AR, AI, MR, and VR in healthcare. The advent of augmented reality, that is AR, virtual reality, that is VR, mixed reality, that is MR, and artificial intelligence, that is AI, tools in healthcare. Benefits both, not only the patient, but also the person operating it. That's kind of our new way of going ahead. Through this session, the speakers will highlight how these technologies can fuel innovatives and play a pivotal role in increasing the accuracy and efficiency and quality of healthcare services. I would like to request the speaker, Gaurav Vyas. Is he here? Yes. Present, sir. Co-founder of Radiant Mobility, and Fadi Hindi, General Manager at Olive L, to take forward.
Hey everyone, thank you for that introduction. As she said, my name is Gaurav Vyas. I am the CTO and co-founder of Radiant Mobility. We are a mobility, wellness, and physiotherapy tech startup out of Mumbai, India. I just have a quick question. How many of you have been to physiotherapy? Anyone? Couple people here and there. Okay, so for everyone who hasn't, basically physiotherapy has a few stages. One of them is you go into your doctor's office and he or she will diagnose you. The second stage is you come back in the beginning, maybe once every 2-3 days, to come back in to your doctor's office for some massage therapy or just to do your exercises. And the third thing is the bulk of it, where they give you these home exercises to do every single day. It's about 15 minutes of exercises. It's very simple, but it's very integral to actually your recovery. And what we've noticed is 70% of people that go into physiotherapy don't do these exercises. And what happens is that kind of prolongs their recovery time. It leads to recurring injuries, and it leads to it could lead to surgery down the road. I myself am an avid sportsman. I've had a lot of injuries. I've gone through a lot of physiotherapy. I recently turned 26, so my back started hurting. And what really I realized is it's just all about doing these home exercises every single day in order to get back to your peak fitness. So what we've built is this mobile application that uses the camera on your phone to track these exercises. Our AI will track these exercises. We tell you whether you're doing this correctly, whether you're doing it incorrectly. We motivate you. And at the end of the day, we send a report card to your physiotherapist. So what happens is, your physiotherapist gets this invaluable data of, your home exercises, and they can use that to do a data-driven recovery approach. And so that's pretty much who we are as Radiant Mobility.
Hello, everybody. My name is Fadi Hindi. I'm the general manager for Olive AI. We're a startup out of the United States, and we were founded in 2014. We're the kind of like the automation company for healthcare systems, both providers and payers. We're in about 1,000 hospitals in the United States, and we've done a few pivots over the years. We kind of pride ourselves on having a higher purpose and trying to change healthcare by driving out inefficiencies and automating, as well as alleviating the burnout of frontline workers from the administrative tasks and the mundane repeatable tasks, and just get that done through AI and digital assistants and AI coworkers. So just out of curiosity, I think we were speaking about the chat, and we were thinking about what is it that we're going to be talking about. So we figured maybe we'll just start by asking you, how many of you are in, how many doctors or healthcare professionals do you have? None? Okay. So just out of curiosity, did you guys just like happen to stumble into this room, or like where you come from? What do you do? You. How about you? Food. Which impacts your health, absolutely. Anybody else? Yeah, we'll get you a mic.
Hello, everyone. So, how did I, or us, get here? It started out as Food 2.0. Okay. And then, I would say a couple of months back, I was told that Food 2.0, merged with Health 2.0.
Okay.
And to be honest with you, and I must be honest,
Please.
I said, I'm a chef. Why are they putting me with the health? And then it dawned on me, something that I'm always saying to my students, food is health, health is food. So it made sense. What do y'all think? Okay.
So the majority of you are food, like food sciences or food industry? Yes? No? So come on, guys. You're not in health. You're not in food. I mean, you know, where are you coming from?
I don't think they expected the fireside. They wanted us to do something.
They weren't expecting the fireside to fire at them.
back, you know.
So go ahead.
So I think in terms of AI, what would be interesting to talk about, you know, everyone, you know, with hello? Yeah. With, you know, with the news and the metaverse and AR and VR, you know, these buzzwords are being thrown around with, like, you know, encompassed with AI. And what I think would be interesting for health, food, fitness, mobility, you know, whatever we are, whatever you're here for, is how AI and the rise of AI and human collaboration, right? So I think a lot of people could be worried that, you know, with the rise of AI, they would replace human jobs. But honestly, I don't believe that's true. With both our, you know, tech companies, our tech applications, the goal of it is more to identify areas where AI could, you know, help humans, could make human processes more efficient, so that humans could focus on, you know, doing what we do best, right? In terms of diagnosis, in terms of understanding other humans. So for example, Radiant Mobility, our main pillar when we started this company is we don't want to replace the physiotherapist, right? It's all about, you know, giving the physiotherapist the data and giving the physiotherapist an insight into their clients' home workout routines, you know, providing them a pre-appointment, you know, diagnostic assessment, once again with data that they can use to drive their client's recovery. And in the end, the client and the physiotherapist are both having you know, a more efficient experience and reducing the recovery time, which is the ultimate goal of physiotherapy.
Yeah, I mean, I think as far as automation and artificial intelligence and machine learning, there's a constant fear of AI and taking over jobs. I think we've heard that, you know, throughout. And whether you're in food or whether you're in health or whether you're in education, there's definitely that fear of machines taking over. And our philosophy also is about, if you've noticed, I was hitting on alleviating the human suffering, because we believe that there's a lot of human suffering as a result of technology that is disconnected. And definitely healthcare is one of those industries, and I'm sure it's prevalent across many different industries. So the way that we look at AI is how can it bring and how can it bridge some of these gaps and make the jobs of people and humans more enjoyable and more focused on adding value, like to patients or to the stakeholder, rather than acting as a router between systems.
And even, you know, like humans' perception of AI, right? How many of you have ever called a health line and allowed the robot or the automated voice to actually solve your problem, right? We usually press 9 as quick as possible to try to get to the human employee and try to get him or her to fix it, right? So yes, that the goal of that automated voice could be to solve the problem, or the goal could be to get all the required data, such as, you know, who I am, what I'm here for, to direct me to the correct consumer. So whether it's, as Fadi said, whether it's food or whether it's healthcare, you know, even in the food industry, right? It's the data today and the AIs that are being used in food delivery apps, being used on even Pinterest boards, being used through Facebook, are actually giving us a better idea of what the human taste bud is, right? And that's where AI, it's not about a a robot flipping a burger, right? It's more about a burger flipping a robot. That would be fun. It's more about taking that data, taking the AI to do the mundane tasks of, you know, figuring out or processing gigabytes of data, aggregating all that data and giving it to the healthcare professionals, the food professionals, and so on and so forth.
Very good. Questions?
Yes.
We got a question.
All right. I think we're doing this right. I think so.
Hi. As you know, India is like a vast country, a lot of languages. Your app would be giving all the informations to the patient, whether he is doing wrong exercise or right exercise, that would be in English or maybe in Hindi. So how would you make your app reach to the remote places?
So I think the beauty of it is that when you build it in layers, right? When you build technology in layers, and that's pretty much what you're taught in engineering school, is the detection portion and the actual communication portion are built completely separately. So if I can detect that my back is bent when I'm doing a certain exercise, my detection portion kind of tells me that the back is bent in terms of maybe a number or, you know, however I want to interpret it. And then the communication layer, which is the super important layer, can communicate it in any language, you know, possible. I think this actually touches upon the benefit of the app that, you know, just because you're in a remote village and you may not be able to speak the language of the doctor that is treating you, this technology can kind of, leap over those barriers and help people either, you know, give it a more, as I said, leap over the language barrier, or even, you know, using AR form like visual aids, right? Like if what we're trying to develop is, if I'm supposed to do an exercise like this, if on my screen there's a ball, right? And all I have to tell the patient is just keep hitting that ball, right? It's more of visual guidance along with audio guidance in their language. So it's not even about whether you understand the language, whether you speak the language, or, you know, what your literally level is, as you said, in maybe that may be lower in remote villages. But the act of, if there's a ball over there and the act of doing this and hitting a ball is the same to all of us regardless of what language we speak. So again, it's all about providing physiotherapists those tools to enhance the client experience, whether it's an in-person client experience, whether it's a remote client experience. And then on the flip side, I don't need my client to tell me in whatever their language or whatever language they speak, whether they, or how they feel, or whether they did the exercise, right? I can kind of see it through the AI, and then it becomes basically in terms of numbers, because 30 degrees is 30 degrees in, you know, all different languages. So that's that kind of benefits us, or that is one of our benefits more than something that we see as a problem. I don't know if you wanted to.
Can I ask one more question?
Yeah, of course.
What about the security of the data? Because generally what happens, like, don't take it otherwise, but generally the companies, they sell those data and they make another chunk of money out of it. So any plans of that?
So the security of the data, again, is with any company, you have to have super secure systems, one from, you know, from when you said security, and I'm sure in terms of hacking, in terms of encryption, because it is health data. This data is super valuable. So, the risk or the benefit is that you have to de-anonymize it, ensure that you're not selling user data. If you are, you're mainly trying to sell trends and you're selling patterns, which honestly could loop back into research, right? If I can tell you that most people doing these exercises of this age face these problems, right? It's more of trying to loop it back into healthcare research and enhancing the product, enhancing the AI, as well as enhancing our understanding of the human body. I hope that kind of answered your question. Anybody else? Yes.
Hi. We're from the food industry, since you asked. So I was wondering, what would you guys in your respective companies or respective apps, or would you like to see as an added value from the food industry? We're in production of food, different kinds of healthy or not or whatever. So what would you like to see from a food industry, a production of food, add value to your business, and how would it work?
Okay, that's a very good question, actually, and I think that if we look at the the higher purpose, we believe every company should have a higher purpose, right? So if you look at Olive, the higher purpose for Olive is to drive inefficiencies out of healthcare, improve patient care, and do it in a way that makes the lives of people that are participating in this ecosystem better and happier. So the way that I would look at this would be from the standpoint of if you're looking at the entire life cycle, like taking care of the patient, we see a long-term vision of actually having wearable devices and being able to go with the patient to their home to monitor their blood pressure, to monitor their exercise. For example, we're talking about physiotherapy over here. We see the food being on the front end of that, right? So what kind of foods are they consuming? How can we bring that data in and look at the holistic kind of record for that particular patient to understand what they're eating, what ailments are they facing, and what preventive medicine could actually be offered to that particular patient? I think that's a much more valuable kind of outcome than separating these different things. I believe that the problem of these silos, regardless of industry, is always the downfall of and failure of those industries, because we're creating these silos. So the food is alone, medicine is alone, pharmacy is alone, and diagnosis alone, and physiotherapy is alone, but it's not a holistic kind of picture. So that would be my take. I don't know, what do you think?
No. I pretty much agree. I think in terms of, physiotherapy, as he said, physiotherapy kind of, once you're recovered, leads to fitness, which, is a close cousin or a close sibling of the food industry, right? And so I think where tech could actually help the food industry and the food industry could actually help tech is providing more sustainable diet plans based on human behavior, right? I think a lot of people are on these very stringent, sustainable diet plans, and I've tried to be on them myself for, fitness as well as whatever, and it's, understanding human behavior through, analytics, through data, through AI, through performance monitoring, through these wearables, and catering specific sustainable diet plans to, different or to these individuals that subscribe to them. I think that could be that could be super interesting way for the food industry, the fitness industry, the health industry to collaborate.
Can we ask actually how, from your perspective, how much is AI prevalent in food today, in the food industry? Are you guys seeing a lot of use for AI and machine learning, or no?
I'm actually a culinary educator at Escoffier School of Culinary Arts, and we're online. So, and this was before COVID. So I see how beneficial it is in regards to being directly with the student at home. The student doesn't have to leave. Now, it's not quite AI in the sense that you were speaking, but I can see that we're headed in that way. You mentioned the metaverse. I find all of that very interesting because as someone that owns a restaurant, not myself, it can be great for marketing, right? We saw what Nike did. They went in and they bought the real estate. Well, all of these people now are venturing into the metaverse to play and so forth. So as foodies, those people like to eat too in the metaverse. So we can advertise to, you know, those avatars within the metaverse, and they spend their money there too. So I think it could be beneficial. I was being cute, hold on.
Very good.
I think it could be beneficial.
Anybody else have seen like use of data and AI in your industry?
We're now seeing a lot of innovation in the food space where they have been examining food security. And if there's a portion of the population that needs to be fed because they're starving, why would we do anything other than try to feed them good food? So we're really talking not just about food security, but an opportunity to create nutritional security. And in being able to improve the diets of those people, we've seen some of the early data has come in during COVID where people have turned to food as a form of immunization against COVID. So in terms of the data that's coming in right now, it's leaving a lot of space for AI to be able to work, to be able to help solve some of these areas and really be able to help create the conversation for the future of food.
You know, you talked about food security. A long time ago, I did some work for one of the ministries, Ministry of Economy, I believe, around early warning system for food shortages. And I'll just share this with you from an AI and ML standpoint because this is relevant for your industry. The more data that you have about the cycles where food shortages have been created, the more that you'd be able to understand and predict what could be happening based on certain parameters that you're seeing. So to me, that's a direct application of AI and machine learning to your industry. You can identify what are the key attributes that have caused certain shortages, and then train a machine to actually look for those indicators, and then let you know when there's a potential, food shortage or crisis that's coming, well in advance for that particular point.
As a follow-up, using machine learning and using AI in terms of the food security and being able to feed the population that is not getting enough food, we can see the increase of operating efficiencies as well through those processes in terms of food waste.
Yep.
And the food waste alone could probably feed all of those people. So we're talking about increasing efficiencies and waste reduction. And I think that there is a clear application for AI and machine learning in that regard.
Are there anybody in food production, like in the audience, like in actual farming and bringing food from farms and into the market? Okay, you want to say something?
No, I thought there was a question at the back.
No, just not a question, but just a perspective. I feel that apart from data, there's absolute need of advocacy to complement that strategy for any security, because the way we sit in the world right now, full of fake news and data being manipulated and also being limited to the rich and the digitally aware class in the society. There's not enough data anyways being being generated from those parts of the society where there isn't an infrastructure. So classic example is this chef called Jamie Oliver, who's started advocating tax on sugar and lunch meals for kids and prisoners turning into chefs, right? I think that sort of movement is absolutely vital, at least in my view, to make the right use and the cognition of the data for the right purposes.
Absolutely. I think, just to build on that point, in terms of the training of the data as well, you don't want, as he said, that the ML outputs only catering to the rich, or the ML perspectives only catering to the people whose data that we have, right? I think you don't want these biases that are there against, discriminating against gender, discriminating against race, right, mainly. And so this advocacy is super important to try to collect data as well as train, as well as regulate these ML, algorithms that are going to drive this AI. And I think that is also going to be something of a proliferation of human jobs with the prevalence of ML and AI increasing.
So I just wanted to ask, like, for example, as you talked about security, for an example, if I am giving you my information of, like, it's a very personal detail, if I'm working out or not, it's very crucial to me. Is there any kind of an agreement or something you'll be signing off, or we will be signing off, to build up the trust that, yes, it won't be going out of hand unless I'm informed about it? First is that, and secondly, I feel people have trust issues when it comes to trusting the MI, AR, VR, all of these technologies. First, they think they're taking off our jobs, and we will be all out of jobs. Secondly, they don't expect them to know the human brain. They don't have the human brain, even though they are smart, whatever, but they don't think that they'll have that accuracy, even though that is. So how can you bring that trust into people to, go ahead and adapt all of these new technologies in our industry?
Okay. Yeah, I think, well, first of all, anything that's related to data has to be, it's going to have to be these terms and conditions where the customer or patient or participating individual in that particular platform, they know what they're giving up and what are they getting. And there's social responsibility for any corporation to make sure that there's no monetization or exploitation of that data. I mean, whether that happens or not, it's neither here nor, I mean, it's going to depend. But there's going to have to be, I think regulators are going to also have to play a part. Otherwise, it will open the door for interpretation or use of that data for sure. So to answer your question, and I'll speak specifically about our company, Olive, we have very strict regulations and guidelines on what we can do with the data, how we use the data, and whether we can leverage that data. And as my colleague was saying here, you cannot use individual data. Usually you have to look at trends or aggregate data. Generally, that's the rule across all industries, right? Now, on the second part of your question, I have lived firsthand the bringing AI and ML into organizations. I've taken a 300 plus, actually 1,200, in one life, 1,200 people, to use digital transformation, AI and machine learning, and get them to leverage that technology. And then later, as a chief executive for a corporation, of bringing AI and ML to 300 person company to take it to the next level as far as transformation. And it was just like pulling teeth. It's very hard. You know, we like the idea, it sounds great, you know, it sounds romantic, yeah, AI, ML, etc. But the minute that robot, and it doesn't have to be a physical robot, it could be a program, the minute it actually hits the doorstep of the enterprise, things change. And people get really, really defensive. So what I was able to do, and it was a growth opportunity for me, because if you think about it as an implementer or somebody that's bringing that particular discipline to an organization, you see it. It's a no-brainer, right? It makes a lot of sense. Guys, let's just implement this. But then to take 200 or 300 people or 1,000 people to actually take that on, it's a totally different challenge. The human brain works differently. So the way that we were able to address that is to explain what you got to do is you got to do a lot of, not hand-holding, but you got to do a lot of education about what we're trying to do is improve the type of work that you're doing. We want to take away the mundane work. We don't want to take away your job. We want to make your job better. This is what we want AI to do. And this is how we were able to get people to actually buy in. And I'll tell you this one story, and then I'll turn it over to my colleague. For me, at one point, it was very easy. There was one particular part of the business that's doing underwriting, and they were handling something like 15 applications per week. And we tried to explain over and over and over about let's just use these AI models to help you do the underwriting and the risk assessment. They wouldn't do it. So after many tries, I said, okay, no problem. We're going to open the floodgates. And what we're going to do, you want to process it manually? No problem. We're going to triple the volume of applications that are coming into your door. Now, whether you want to do it manually or leverage the computer, it's up to you. But I expect, as the chief executive, I expect all of these to be done in the morning. It took 2 days, and then they completely switched over, like, all right, run the AI. So at the end, you know, it's only common sense. And it's interesting because the moral of the story, it took about 2 months, even with the AI turned on, it took about 2 months for them to say, all right, now we get it. I get it, because I'm enjoying my job more. Now, after seeing the AI run, and the AI is taking care of the paper shuffling and taking data from this system and putting it in that system, and OCRing the information on the form versus having a human do it. So their higher level brain functions got engaged, and all of a sudden they started enjoying their job. But that takes time.
I think we all are scared after watching Terminator. We all came to know about AI from there. Yeah, you can go ahead.
No, I think you pretty much hit the nail on the head. Just to add a little bit to the initial question of data privacy, as we move into what many of you might heard of as Web 3.0, right? Where there's no one central entity that may own the data, and whether it's blockchain that kind of takes over, or how we move into that era where people are more cognizant of their own of their data as well as their privacy. I think user consent, companies selling data is going to become much more, a little more restrictive, and the power is going to come back to the users, just because there is no one central entity that will own the data. So each individual will have to, or will get the chance to own their own data. That's a conversation for Health 3.0. Any other questions? We have a red blinking screen here. I don't know. Do we get ejected? Just James Bond style?
I think we're done, yeah? Thank you very much. Thank you for listening to us. We really appreciate it.
Thank you, Mr. Fadi and Gaurav. It was really interesting. A lot of headway was made into this critical topic in this session. Thank you, speakers. Proceeding forward, it is now time to facilitate the individuals and the organizations that have played critical and crucial role in revolutionizing the healthcare, F&B, and nutrition segment. I would like to invite Joseph Cohen, a CEO at Cell Decode, on stage to present the awards to the old winners. So the first award goes to Delicata Food LLC, and I would like to represent the representative of that company is Mr. Faris Al-Majidi and Ziad Bushrad. This award is presented as Best Company Award. May we have a few words from you guys? Please may we have a few words? Mr. Faris, Mr. Ziad, any one of you?
Thank you very much. It's a great honor to have this award. We're doing our part in bringing in healthy food, and we're a frozen product. We did a lot of research to get to the point of bringing in the home cooked, the taste and the healthiness of a home cooked meal that is available to everybody. So we're all about innovation and solutions to really bring in health to the food industry. So thank you very much. It's an honor. And
Thank you so much and congratulations to you. Now I would like to invite on stage Dr. Jag Prag for the award of Outstanding Leadership. We can still clap if he's not here, that's okay. Now the next one I would like to call Dr. Lepi Singh. This award was also for Outstanding Leadership Award. Now I would like to call Fernando Boras. We'll have to applaud real harder because he's here. This award is presented as an Outstanding Leadership. Few words, Mr. Fernando.
Thank you. So I'm here representing the health industry, but as well I think there is a big correlation, as we've said. I think, the last 2 years, especially with COVID and working for a top healthcare company in the world, I think we have changed the standards of working, especially taking care of the employees, working in a hybrid environment. And what I can tell you is, especially in my company, we really focus on patients first, as all the multinationals, all the pharmaceutical companies, but as well, something very important as well is we focus as well in the employees. So we have really delivered a lot of capabilities on how to really work in a virtual environment. We have as well promoted the coaching culture, so how to, outside your day-to-day routines, how to be and work in an open and agile mindset. And as well, we focus a lot on the crisis management committee, managing COVID, making sure all the employees were safe, safety first, and as well, this was delivered as well into our patients. So thank you very much for this award.
Congratulations, Mr. Fernando. Now I would like to invite on stage June Tachibana for an Outstanding Leadership Award. I must say I am loving the tie you're wearing, so.
I would like to thank Health 2.0 for this opportunity. I'm honored to receive this award. My focus area is oral health care. So I believe oral health is a key lever to general health. So thank you very much.
Thank you so much for your contribution. Well, I would like to call one of my favorite now, Miss Green Chef Coco, on stage. She is also winning an award for outstanding leadership. He wins.
Hello, everyone. I'm Chef Coco. It is my nickname. And I would love to thank all of you and the whole Health 2.0 committee, team, and so forth for inviting me here. It's special to me because I have one of my mentees. She's from Uganda. She lives here in Dubai. She's been following me on social media for probably 6 years, and we finally met today. She is a young chef. So my goal, it's not quite health, it is food, but like I said earlier, food is our vehicle, and I would like to take the hands of as many young people as I can to venture in not just into food or health, but what the gentlemen were just speaking on, this new innovation and what it can do for people like you. So it's not just about cooking the food, it's elevating the ingredients to higher heights. All right? Thank you all.
Congratulations, Chef Coco, for your award and the book you're coming up with. And the next award would be for Kurutika Shah. That is also the award for outstanding leadership. Okay. She is thankful to the family and God. The next award we will be calling upon would be for Mr. Musaddiq Ullah Khan. Okay. It is for outstanding leadership. The next award is for Manare Live. The representative is Stephanie Gantos. It's one of the best companies. Thank you.
for this award. It's an honor for me and my company. And thank you for the committee for this great conference. Thank you.
Thank you. Now for Olive AI Inc., Mr. Fadi Hindi. Wow, we have to applaud him. Come on, he gave us a really good answers.
Yeah, you guys have heard me talk already, so I'm not gonna bore you. But on behalf of Olive AI, I want to thank the organizers for the opportunity and the honor of winning this award. Just a brief, as I said, Olive has a higher purpose of making the healthcare industry better, and especially alleviating the human suffering. That's our higher calling, to make sure that we drive out all these inefficiencies and make people's lives better by using automation and artificial intelligence. And we look forward to bringing Olive to the Middle East and Asia Pac and take it globally. And would love to learn some of your recipes, Chef. So I'll connect with you right after this speech. Thank you very much.
Thank you. The last award for the day would be for Shigeto Miyamoto for outstanding leadership. May I have all of the awardees on stage so we can have a group picture, please? With your awards. Congratulations to all of you. Thank you so much for your valuable time. On behalf of Health 2.0 Conference and everyone present here, congratulations. And it was an honor to be here alongside you guys. With this, we have reached the end of day one of our conferences. You can proceed outside for refreshments and you can have a word. My name is Talia MK and I'm signing off for today, and we'll be getting along tomorrow and day after. Have a good day, guys.